Hello everyone and welcome to my channel. In this video I'm going to talk about choosing your nursing speciality as a newly qualified nurse. There are so many different areas of nursing that you can choose from, and sometimes it can be really overwhelming. You can specialise in neurology, you can specialise in renal care, cardiac care, respiratory care, oncology. You can decide, whether you're going to go into intensive care straight away, if you're going to go into the high dependency unit, if you want to work in the community, if you want to work in a GP practice. There are so many different nursing specialities, and sometimes it can be a bit overwhelming thinking, oh my gosh, I've got all of these options available to me. What is it that I want to go into first? And I do want to very quickly say that when I'm talking about nursing speciality, I'm not talking about like your respiratory nurse consultant or your clinical nurse specialist. I'm literally just talking about what area of nursing it is that you want to go into as soon as you qualify. Or you could be like me, who's already working as a nurse, and you're thinking, oh, I kind of want to change my area of nursing, my speciality. Where is it that I want to go from here? This video was requested by one of my subscribers, so if you do have any video requests, put it in the comments box below. If you have any questions, comments, queries that you want to make, put it in the comments box below. I do have a very active community of subscribers, so if it's not me that responds to one of your comments, chances are somebody else will respond to your comment, which I really appreciate. So just to give you guys a bit of a background, I completed my 4-year undergraduate Masters of Nursing degree, and right now I'm working as a Band 5 registered nurse, and I've been in this role for the past, or I've been working as a Band 5 nurse for the last 18 months, to the last year and a half. When choosing your nursing speciality as a newly qualified nurse, there are so many things that you need to consider. We can't go through all of it in the video, so we're just going to go through a handful. We're going to talk about patient contact, we're going to talk about your level of experience, we're going to talk about, very importantly, your interests, the stress level, and what sort of shift pattern that you want to work as a newly qualified nurse. So let's just start, because this is a very wide topic. So let's start with the schedule that you want. If you want to work like your typical 9-to-5 job, then working on a typical inpatient ward might not be the best option. Then I will consider choosing outpatients over inpatients, because most outpatients facilities tend to run anything from about 8 all the way till 5. The hours may vary, but it does mimic the typical pattern that you would find in any other professions. I know some of my colleagues, or when I was a student, some of my other students or some of my other cohorts, they just wanted a simple 9-to-5. Maybe they had a young family, maybe they had like another part-time job, or maybe they had like other commitments, and they knew straight off the bat that they couldn't cope with working long days, earlies, long shifts, short shifts. Like if you're working the typical nursing timetable, your shifts are all over the place. You can't say Monday, Tuesday, Wednesday I'm working this shift. Every week your shift pattern will be different. So if you're looking for a more stable shift pattern, then I would suggest working in outpatients, where you can be guaranteed that Monday to Friday these are the shifts that you're going to work. Another thing that you want to consider when working as a newly qualified nurse, when choosing your nursing speciality as a newly qualified nurse, is the patient contact. Some people, when they do their nursing degree, they know that when they qualify, they want to be with patients all the time. And there's some people who are kind of like, I don't want to be with patients all the time, but I do still want to have a massive and a positive impact on their life. There are other options that you can consider. For example, research nursing, or research nursing is the only kind of nursing speciality that I can think that newly qualified nurses can get involved in. Obviously, as you work your way up the nursing grading, then there are more options available to you. But as you start off as a newly qualified nurse, the first thing that comes to mind for those of you guys who don't want as much patient contact will be research nursing. But for those of you guys who do want, the maximum amount or the standard amount of nursing patient content, then I would recommend what I'm doing, which is basically just working on their ward, whether it's inpatients or outpatients. Whether it's cardiology, HDU, intensive care, that's what I would recommend. The next section is your interest. If you had a handful of placements, for example, on a neurology ward as a student nurse, and you know that you absolutely enjoyed it, then why not explore that even further? If maybe you had like a place where you liked it, but because of other reasons, for example, maybe the timing of the shift, or maybe because your mentor wasn't that great, or maybe there was another thing in a way that meant you couldn't get the most out of that placement, then again, why not explore that, why not explore that even further? When I think back to my experience, my first my first ever nursing placement was on a respiratory ward, and I knew hands down that when I became a newly qualified nurse, the first place that I wanted to work was a respiratory ward, and that's what I did. So go through what placements you really enjoyed, the reasons why you enjoyed them, because just because you enjoyed it doesn't mean you should go into that speciality. You maybe could have enjoyed it because your mentor was really good, or you could have enjoyed it because the hospital wasn't far from where you lived. But write down a list of placements that you didn't enjoy and write down the reasons why you didn't enjoy it, because the reasons why you didn't enjoy it may not be actually down to the nursing role in that environment. It could be because your mentor wasn't great, it could be because the hospital was really far, it could be because you had essays due around that time and those essays were really hard and it was impacting your ability to make the most out of that placement. So I'd say go with your interests. Now what I also want to talk about, I think I've hit all the points. I've talked about scheduling, I've talked about your interest, patient contact, and stress. Yes, stress. So let's talk about stress. Some people might say, oh, don't do intensive care, don't do A&E nursing because that's too stressful, you can't handle that. I can say when I was a student nurse, I had a placement at an A&E and that placement was 18 months long. Yes, it was a very long placement. That was because I did a 4-year undergraduate Master of Nursing program rather than a 3-year undergraduate Bachelor's of Nursing degree program. Anyway, yes, that was an 18-month placement in A&E, and I can say hands down that A&E isn't the sort of place where it's stressful all the time. There were some parts where it was really, really stressful, and there were some parts that were quieter. For example, if you're working a night shift on a certain day in comparison if you're working a day shift on a certain day, it can vary. So don't think that, oh, if I go into A&E nursing straight away, it's going to be super stressful, or if I go into HU nursing, it's going to be super stressful. As a newly qualified nurse, I can say wherever you go, the first couple of weeks are going to be stressful, just as you're transitioning, because you are transitioning from a student nurse. Okay, there's someone outside. Because you are transitioning from a student nurse to a newly qualified nurse, so don't let that put you off. Similarly, there are some people who say, oh, working as an outpatient is not going to be stressful at all, or working in a GP practice is not going to be stressful at all. What I want to say is that when you're thinking about where to work, don't just think about oh, it's cardiac, or oh, it's renal, or oh, it's GP practice, or oh, it's community. Think about the other factors. How long is it going to take you to get there? What is the nurse-patient ratio? What is a turnover of staff? Because I've been on some respiratory wards where the turnover of staff was really high, the nurse-patient ratio was really low, and I didn't enjoy that experience. And I've also been on respiratory wards where the nurse-patient ratio is perfect, the nursing turnover isn't so high. By turnover, I mean you don't have nurses coming in for 1 week and being like, I hate this, and leaving and never coming back again. There are so many different factors to consider. Now, I also want to touch upon like going straight into A&E, or going straight into GP practice nursing, or going straight into HDU, because there's like, I don't want to say a misconception, but I know back in the day, probably like 4 or 5 years ago, when you finished your nursing degree, you could just go straight into A&E, or you could just go straight into become a practice nurse, or you could just go straight into, I know, working in intensive care. They wanted you to have at least a year experience before you moved over, or before you crossed over into these areas, and I can understand why. But now that has changed. As a newly qualified nurse now, you can go into A&E straight away, you can go into intensive care straight away, and don't let people tell you that, oh, you should go on a ward first. Even though I went on a ward first, I went on a ward first just because that is what I wanted to do, that is what I wanted to get more experience in. However, if I wanted to go into A&E as a newly qualified nurse, you've got the qualification, you've got your NMC pin, just go straight into it. Don't let anyone tell you that, oh, you need to get I feel quite passionate about this subject because it really annoys me when you get older nurses, or not even older nurses, but when you just get so many people telling you, oh, you need to get at least 1 year experience on a ward before you go into A&E. You need to get at least 1 year experience on a ward before you go into intensive care. If the job description says we are accepting newly qualified nurses, then go for it. Because sometimes people say, oh, you need to go on a ward because you need to get the foundations of nursing. So are you saying that you can only find the foundations of nursing on a ward? Are you saying that if you were to go into HDU, or if you were to go into ICU, or if you were to go into A&E, are you telling me that the nurses there don't practice the foundational parts of nursing? And when I'm talking about the foundational parts, I'm talking about things like washing and dressing, assisting patients with eating, just like your really, really basic stuff. Are you telling me that the basic stuff of nursing doesn't apply to nurses who work in intensive care, or doesn't apply to nurses who work in A&E? When I had my very long placement on A&E, I was surprised at how social heavy A&E was, because before I started that placement, I know it was as a student nurse, but technically I could have graduated that year. But before I started that long A&E placement, I was thinking, oh, A&E is going to be not easy, but I was thinking it's going to be different from the ward in the sense that you don't have to worry about the social aspect. All you need to do is stabilize a patient, transfer them to the ward, and then the ward will deal with the social aspect in terms of doles, in terms of whether the patient's got capacity, in terms of the patient's social care, where they're going to be discharged after. No, as soon as a patient comes into the hospital, a lot of the patients that will be through A&E, the social aspect is there, hands-on. You are doing nursing referrals, you are contacting the substance misuse nurse, you're contacting the mental health team, like you're contacting so many different parts. So don't think that, oh, I can't go A&E first, or oh, I can't go intensive care first because I don't want to lose the basics of nursing. You'll never lose the basics of nursing working in A&E or working in intensive care or even working on a ward-based level. It's called the foundations, it's called the basics for a reason, because you carry it to every single part of nursing, regardless of whether you're working in an area where there's high patient contact or you're working in an area where there's not as much patient contact. There are still factors, there are still things that you need to consider. Another thing that I want to touch upon is, what was it? It's literally just in my head. I also wanted to talk about, oh wait, I've got my notes on my phone. What is it? So I talked about the foundations. Oh yes, I also want to talk about DeSkilling, because there's also the thing that, oh my gosh, if you go into community nursing is not for me, because I don't like the idea of going into people's houses. I think it stems from the fact that I had like a mental health placement, a community mental health placement, and we had to go into people's houses, and obviously it was a mental health placement. Some of them weren't in their best frame of mind, and I liked the placement, but I didn't like the aspect of going into people's houses, especially when it was like you didn't know where they were at. Really freaked me out, but I think I learned a lot. I definitely learned a lot in that placement. Anyway, going back to what I was saying, some people were saying that, oh, don't go into community nursing straight away, or don't go into theatre nursing, because that is also an option as well. I know one girl who went straight into theatre nursing and she absolutely loves it. But yeah, don't let people tell you that, oh, if you go into theatre nursing straight away, or if you go into community straight away, that you're going to lose your nursing skills. Maybe 4 or 5 years ago, not even 4 or 5 years, yeah, maybe like 5 to 10 years ago, where the community nursing role was completely different, then maybe you could say that. But now you have community nurses who are obviously giving medication, who are nursing prescribers, who are setting up IVs at people's homes and stuff like that. You have theatre nurses who are doing a lot more complicated stuff than they would have been doing 10, 20 years ago. So don't let people say that you're going to de-skill. I still do kind of agree with community nursing in a sense, and theatre nursing in the sense that you might de-skill, especially with outpatient. But in my experience with the general hospitals, when I do go to like outpatient facilities, a lot of them tend to be like older nurses, or nurses who just work part-time, or nurses who have retired and have come back to do a couple of shifts, and I think it's that for a reason. The nursing skill set is very different, however it can be very complex. It's like a massive circle. Let's just say nursing is a massive circle, and rather than trying to capture the whole circle, of knowledge, it's just like a tiny pinpoint of knowledge. And yes, it's a tiny pinpoint of knowledge, but it's a very dense amount of knowledge that you need to understand. So if someone wants to come to me and basically say, oh, I want to work in A&E, I want to work in intensive care, I'm a newly qualified nurse, I say go for it. You've done your nursing degree, you've got your PIN, go for it. If you meet the criteria, or if you think you meet the criteria on the job specification, and the job specification says we are accepting or hiring newly qualified nurses, go for it. If someone wants to come to me and say, oh, I want to work as a community nurse, or I want to work as a theatre nurse, I'd say definitely go for it as well. But like I was saying earlier, don't just look at the nursing role, also look at the nursing turnover, look at the nurse-patient ratio, look at the ability to progress, or look at any educational packages, any study days that you will also be offered in that role. And also look at like teaching hospitals as well. All hospitals, you can learn everything and anything from any different type of hospital. But if you're worried about, oh, I want to learn as much as possible, then consider teaching hospitals. It's in the name, teaching hospitals, because they work really closely with universities, with research companies, to make your experience as positive as it can be, and most importantly, to make the patient's experience as positive as it can be. So yeah, that's what I can say about choosing your nursing speciality as a newly qualified nurse. And I don't mean a clinical nurse specialist, and I don't mean a consultant respiratory nurse. I basically just mean what area of nursing it is you want to go into straight away. I think I've kind of covered everything. If there's anything that you want me to expand on, or anything you think I may have missed, then make sure you put it in the comments box below. Me and one of my other subscribers will be more than happy to share our information, to share our knowledge with you guys. We are a very active community. I do want to do a separate video talking about moving to the city, moving to London or moving to any other city as a new qualified nurse, and whether your experience there would be better or not. So if you think that is something that you'd be interested in, then make sure you subscribe to my channel if you haven't already done so. Turn on the notification bell and like this video so I can continue doing more videos catered to newly qualified nurses. Most of the videos so far on my channel are catered to student nurses and pre-nursing students, but I want to kind of open up the arena. So if I know that there is a demand for videos catered to newly qualified nurses, like the video and I'll continue to do more.